For the following conditions, the urine collection bag needs to be replaced in a timely manner. Elderly patients who require strict recording of hourly urine output to closely monitor changes in their condition. For preparation before certain surgeries and post-surgery care to facilitate drainage and flushing, to promote the healing of the incision. For patients with urinary incontinence or perineal wounds, drain urine to maintain perineal cleanliness and dryness. For patients with indwelling urinary catheters when urine bag replacement is indicated, the specific operational procedure is as follows. Firstly, conduct an assessment. Environmental assessment. Assess that the environment is clean and free of odors. Assessment of the elderly. The elderly patient's medical condition, level of consciousness and cooperation ability. Local assessment of the patient's urinary function. Peripheral condition of the urethra. Diagnosis. Determine the need for urine bag replacement after assessment. Plan. Replace the urine bag for the elderly patient in approximately half an hour. Execution. Firstly, prepare documentation forms, a pen, gloves, hemostat, padded towel, clean urine bag, cotton swabs, povidone iodine. The caregiver should ensure clean attire and wash hands thoroughly. Communicate and explain the purpose of the operation to the elderly. Instructions for cooperation. Firstly, check the urinary catheter. The urinary catheter is fixed and not dislodged. Ensure unobstructed drainage. Place a sterile drape under the connection between the urinary catheter and urine bag. Keep the bed unit tidy. Discharge urine. Observe the color, consistency, and volume of urine in the urine bag. Open the urine drainage port, empty residual urine, and close the port. Close the drainage tube clamp. Changing. Wash hands and put on gloves. After opening the sterile urine bag, close all switches and check for completeness. Place it at the bedside for later use. Use hemostatic forceps to clamp 5 cm above the urinary catheter opening. Separate the catheter from the bag. Place the contaminated catheter and drainage bag at the bedside to prevent interference with the procedure. Disinfect the catheter port and surrounding area with povidone iodine swabs. Connect a new sterile urine drainage bag. Release the hemostat clamp. Open the urine bag drainage valve. After confirming that the drainage is clear, close the drainage valve after confirmation. Empty urine from the drainage bag every 2 hours. Secure the indwelling catheter and drainage bag properly. Adjust the drainage tube to an appropriate length and height. The urine bag must be positioned below bladder level at all times. Remove and discard the protective drape. Make up the bed unit. Dispose of contaminated materials in designated medical waste containers. Perform hand hygiene after the procedure. Instruct the elderly patient not to manipulate the catheter or drainage bag. Ensure catheter safety when repositioning the patient. Documentation. Record urine color, characteristics, and volume accurately. Assess patient comfort following the procedure. No discomfort or pulling sensation reported during the procedure. No other discomfort. Tidy environment. No contamination of objects. Reasonable disposal of materials. Important considerations for urine bag replacement. 1. Urine bags should be replaced at regular intervals. Refer to the instructions for different types of urine bags for replacement intervals. 2. During urine bag replacement, observe urine color, volume, and characteristics closely. If there is any abnormality, notify medical staff immediately for assessment and intervention. 3. Secure the catheter properly. Maintain unobstructed catheter drainage. Monitor for catheter displacement and urine leakage at all times. Avoid pressure, twisting, folding, etc. 4. Maintain aseptic technique during replacement. Height of the end of the drain. Always position below bladder level to prevent. Avoid contamination due to backflow of urine. 5. Inspect skin around catheter insertion site. If there is any redness, swelling, and ulceration, notify healthcare providers promptly for appropriate management. That's all for this lesson. Thank you, everyone.